Several of the implants that I've changed out in the last several weeks have been low profile and they look flat. They look very unattractive. First, let's talk about the consistency of the implants. If you look here, you can see that this implant has a little bit of a divot in it because it's not as firm. When I squeeze it, it's a little bit softer. This implant is a little bit more constructed, it's more form stable. This implant has barely any divot at all. Now let's put these on the table here. Responsive, soft touch, cohesive. Cohesive are essentially the gummy bear implants. This is the style that I use the most. Why? Because it's more form stable, it has less chance of rippling and less chance of capsular contracture. It's also most durable. You can see here, none of these are going to break, but I'm putting pretty good force on that. I've seen plastic surgeons where they've literally driven their car over the implants. I'm not going to do that because I can't get a car in my boardroom here. All jokes aside, you don't need to do that, okay? You're never going to have that much force. But suffice to say, these implants are incredibly durable. The takeaway here is the fact that this implant, the responsive implant, is a much softer implant. This is a great implant. I've used the soft touch for years, but now I've really switched almost exclusively over to the cohesive. Why? It's more form stable, but even though it's form stable, it feels soft in the pocket. So in other words, it doesn't feel like you have these firm breasts, but you get more control over the upper pole. So that's kind of the long and short of it. Now, I do want to show you something. Let's look at the cohesive full profile, and let's look at the moderate. These are just about the same size. But if you notice, this has a much more arched look. This is flatter. This is wider. This is narrower. Why is that important? Because every patient is constructed differently. Every one of you has different breasts. There isn't one single perfect implant. I will say, though, that I don't use a lot of moderate plus profile implants. The reason being is they're wide and they're not very projected. When I put the implant up like this and I get nice projection, that's what most patients want. Most patients don't want a wide, flat breast. They want a little bit narrower breast that has more profile, more projection this way. Send me your questions. Let's have a dialogue because I think this is one of the hardest things for patients to really wrap their arms around. When you're looking at breast implants, you really need to understand what you're buying. It's not one size fits all. There is no one perfect style of implant or one perfect profile implant, and there's no one perfect size of implant. You need to pick the implant that's perfect for you. You need to be educated. I hope this helps. Dr. Buford from Beauty by Buford.